Have you ever felt discomfort due to abnormal discharge, odor, or itchiness? Have you noticed a fishy, rotting smell that's different from usual? Is there so much vaginal discharge that you need to change your underwear several times a day? And what about the unbearable itching that you can't scratch? It also is really itchy and smells bad, so you probably feel embarrassed and overwhelmed, right? While a strong odor and or itching is often a sign of vaginitis, if you are dealing with a lot of discharge, it could also easily be something else. Hello everyone, this is Dr. Yang, and welcome to Trinity TV. I understand you are here because you've been experiencing some symptoms related to vaginitis. I'd like to explain the condition, why treatment is important, and the steps I will take to help you recover. Vaginitis is an inflammation or infection of the vagina that can cause discomfort, itching, and abnormal discharge. It can be caused by bacteria, yeast, or even allergic reaction to products from soaps or dishes. If left untreated, vaginitis can lead to more serious infections or complications. When you go to the gynecologist, they usually perform an STD test. STD test stands for sexually transmitted disease. It is easy to get tested for STDs with the exception of HPV, as it is covered by the Korean national insurance. Typically, there are 12 types of tests performed. Among these 12 types of bacteria, 6 are classified as sexually transmitted infections: Mycoplasma genitalium, Treponema, herpes type 2, trichomoniasis, chlamydia, and gonorrhea. The remaining 6 are not STIs, but are common vaginal infections. In the case of STIs, it is essential to retest after completing treatment to confirm that the infection has cleared. While certain infections or STIs can be treated easily, others require specific treatment. Knowing the exact type of infection or STIs allows for the most effective treatment option. To confirm whether it is vaginitis, I will first need to take a sample of your vaginal discharge. This will help us determine the type of pathogen, whether it is bacterial, fungal, or something else. This sample will then be sent to the lab, and the result will guide us to choose the most effective treatment. Now let's briefly discuss what to expect during the testing process. I'll take a sample of vaginal discharge from you. While there should be no pain, it is possible to experience some mild discomfort. You will start by changing into a gown. A sample will be taken from your vagina and sent to the lab. You will be prescribed a medication to relieve your discomfort. Result will usually take a few days, and depending on your result, additional treatment may or may not be required. Generally, the reason people develop vaginitis or cystitis frequently is due to fatigue. When your body is exhausted, your body becomes much more vulnerable to illnesses and diseases. If the test results show vaginitis, it can usually be treated quickly and effectively with medication. However, the belief that it'll just get better on its own is a dangerous misconception. Many individuals can carry STIs without showing any symptoms. One of my patients hadn't had a sexual partner for a year and a half. However, this past summer, she experienced some itching and decided to get tested for STDs. Although she had no noticeable discharge or odor, the test result came back positive for chlamydia. I was surprised, and she was too. She asked, "What's going on?" In this case, it's likely that she had a previous infection that remained asymptomatic. If someone is unaware of their status and has unprotected sex, they can unknowingly transmit the infection to others. For example, if chlamydia is left untreated, it can lead to cervical infections for women. And if it becomes chronic, it can result in pelvic inflammatory disease and fallopian tube inflammation. For men, it can cause chronic urethritis and potentially lead to more severe inflammatory diseases. It's crucial to pay close attention to this issue, as neglecting it can lead to serious consequences. If you have ever been infected with an STI, even if you have no symptoms, you should make it a priority to visit to a gynecologist for regular checkups at least once every 6 months, although this may change depending on your situation. Most infections can be treated with medication. Once I receive the result, I prescribe the appropriate treatment. If it's a bacterial infection, I'll treat it with antibiotics. If it's a yeast infection, antifungal medication will be used. I will also provide advice on how to avoid recurring infection in the future, such as change to your hygiene routine or avoiding certain products. I will typically prescribe treatment for approximately 5 to 7 days. After starting treatment, you should feel relief within a few days. However, it's important to finish the entire course of medication, even if your symptoms improve. I will also typically schedule a follow-up appointment to ensure the infection has completely cleared and that you are feeling better. It's important to treat both you and your partner. Infections can pass between partners, so it is important for both parties to be treated to prevent reinfection. A single treatment does not permanently eradicate the bacteria. Medication helps to suppress the bacteria in the vaginal area to a level where symptoms do not appear. The presence of even a small amount of bacteria means that recurrence is likely. This is why women who have experienced vaginitis once will often face recurrence when they feel tired or stressed. Preventing vaginitis may not be easy, as it is unrealistic to maintain peak physical condition at all times. However, you can support your body by consistently taking vaginal probiotics to boost immunity in vaginal area. Probiotics, beneficial bacteria that help to inhibit harmful pathogens in the vagina. Since vaginal probiotics are just supplements for vaginal health and not a medication, they need to be taken continuously over an extended period to achieve the desired result. Many people stop taking them after just 1 or 2 months, thinking they are ineffective. However, it is recommended to take them for at least 6 months. If you don't see results from oral biotics, consider using vaginal tablets or spray-type probiotics in combination. If you experience unusual discharge, itching, or other discomfort, don't hesitate to contact a clinic. In Korea, you can easily make an appointment when you call the clinic. On the date of your appointment, you will receive a consultation and get a prescription if needed. If any tests are conducted, you will be informed about any additional treatment options after the results are available. Don't hesitate to visit a hospital in Korea. Ignoring the issue could make it worse. If you have any questions or need treatment related to pregnancy, childbirth, or contraception while staying in or visiting Korea, feel free to contact a clinic at any time.